Colorectal cancer is the third most common malignancy and the second most deadly cancer worldwide. The large number of colorectal cancer cases poses a global public health challenge. So raising awareness about colorectal cancer will help to improve lifestyle choices, but also to identify new therapeutic strategies and to implement larger screening programs, all of which we believe will reduce cancer mortality and morbidity in the future. So to identify new therapeutic strategies, researchers need to have access to high-quality patient samples that are coming along with the clinical and the pathological information. And exactly for this, the Molecular Disease Mechanisms Group at the University of Luxembourg, together with all their collaboration partners, has established an ongoing colorectal cancer collection, which includes nowadays more than 160 patients with very precious samples. And exactly those precious samples will allow us to identify new therapeutic strategies, but also substances which help us to monitor disease progression over time, which are called the so-called biomarkers.
Yeah, this collection, initiated in 2010, has been achieved through a joint effort involving oncologists and surgeons of different hospitals in Luxembourg, especially our hospital, the Centre Hospitalier Emil Mayers, involving study nurses from the Clinical and Epidemiological Investigating Center, the LIH, pathologists from the LNS, as well as tumor sample managers from the IBBL Luxembourg, and finally researchers at the University of Luxembourg. This collection contains several sample types such as serum, stool and tumor tissue, and finally normal counterparts from the same patients, which allow us to perform high-level research.
This is a perfect example of successful translational research. That means that from the lab in the university to the bedside in our place here in the hospital, we have outcomes which have been established due to the tissue samples which are processed in the lab, which led to the recognition of a new oncogene, potentially prognostic and predictive biomarker. That means a marker which I could use in my daily routine for patients with colorectal cancer to choose the right treatment to give them the best outcomes.
Since we collect the tumor cells and the many different cells in the tumor microenvironment, it allows us to generate mini tumor models here in the lab. These models really nicely recapitulate the original tumor. This allows us then to test many different drugs in the hopes of identifying new treatments, which ultimately would contribute to saving more lives. In essence, these models allow us to foster personalized medicine.
Over the past years, we have acquired extensive knowledge in the exploitation of the results generated by such a colorectal cancer collection. We have, for example, identified biomarkers, and those might be able to be translated into the clinics to identify colorectal cancer early in time and thereby prevent recurrence of the disease. Our research is very expensive and would not be possible without the support by public funds and also private foundations. If you are a patient and you are interested in our research, please ask your doctor about our study. You can help us to make the difference.